2009 is when it first began. I then sort of learnt that the RFDS had an on-the-ground primary care role for mental well-being, driven by the need to do something about the suicide rate in the West and in the remote Queensland. It was something that we then started. We ended up, we had 33 riders, 5 ladies, and went and did it and raised $225,000 in the first year, which we handed over to the Flying Doctor. In 2014 and the next ride, we had one ride in 15 between Longreach and Tennant Creek. We hosted a couple of returned soldiers from Afghanistan. They were young officers that had come home with PTSD. And one of them, a couple of years after, wrote me a note. He said, the warmth and encouragement that RideWest affords helped me pick up from my very darkest days of an awful depression and confirmed for me the value of having good people in my life. In 18, we sort of started to officially hand over to Peter and and John. Hall Chadwick have taken RideWest to another level that we couldn't take it to. The social media, a deeper list of corporate sponsors, engagement with a much wider community. And I think for us, Shelley and I, probably the best thing we've got out of RideWest is knowing that succession plan, is knowing that the thing that we started will endure.
We're very honoured to be the beneficiary, and it's something that we want to honour going forward, and we want to say thank you to Hall Chadwick for taking up the mantle to take it forward. It's brilliant what the practice is doing. Our commitment has been that every dollar that comes to us from RideWest is delivered through to the program, to the Wellbeing Out West program, and we've lived that, and we will continue to live that commitment. One of the great benefits of the RFDS delivering the service is that those in the bush trust the organisation, they trust the brand, and we live that trust to make sure that we can deliver that, treat with confidentiality and respect those that approach the RFDS. A very important part now of our programs is the mental health outreach. It's really helping with that whole destigmatisation of mental health.
There's a big population of people that live in Brisbane that have connections out here, and we've tapped into that community. We want to take money from that corner and spend it out here. So we don't try and raise money from anywhere past Oakey there. The idea is to get all the money down in the corner and bring it out. We've got a very close relationship with the underlying, people, boots on the ground.
Where would you rate RideWest in the things that you've done in your life?
I guess RideWest would have to be it for particularly for Shelley and I, certainly I, of creating something and seeing the results of it, and as I touched on probably in the earlier, seeing it endure, and particularly the relationship with the RFDS our role's a bit uncomplicated in terms of we sort of harvest some money and give it to the experts to see it through to its end cause.